Okay. Hello everybody, greetings and welcome. We're going to talk a little bit about basic life support and advanced cardiac life support. You'll see a scenario as part of this video that takes you through an arrest protocol, but I think it's important to go through each of these BLS and ACLS, as they're called, scenarios. Now, ILCOR, which is the International Liaison Committee on Resuscitation, which is made up of several groups including the Australian Resuscitation Council, European Resuscitation Council, the American Heart Association, puts together best evidence guidelines for us in order to perform the best resuscitation. Now, these are not infallible guidelines, however they are the best evidence we have, and there is academic difference between individuals as to whether these are the best approaches. However, this is the best evidence we have and therefore we comply with it. Now, we're talking about an unresponsive patient, or a patient with no signs of life, and that would include no breathing, no movement, and no cardiac output or no pulse. And in that scenario, whether you're on a ward or whether you're in the street or whether you're in an emergency department, you will start with some fairly basic life support. And basic life support in the old language was Dr. ABC, which was doctor stood for danger. Make sure that there is no danger. So if you're out on the street, if somebody has an arrest, you want to make sure that there's no way that you can be electrocuted, for example, or if they've had a collapse and an arrest in the middle of the street, that you won't get run over. So you've got to remove yourself from that danger first. Then you check the patient's response. And so checking the patient's response may be as simple as shaking their shoulder. You may want to put a little bit of pressure on their sternal bone, but basically shaking their shoulder. If there is trauma involved, you do not want to be lifting the patient up because you don't want to be moving the cervical spine. If there is no response and there is no signs of life, then you need to go into your basic life support protocol. The first thing we do is open the airway, and if there is no potential of cervical spine, and whenever we talk about airway, cervical spine is always associated, especially if we have a trauma. If there is no evidence of cervical injury, then we open the airway by two very simple techniques. The first one is head tilt and chin lift. And the whole idea of doing this is to move that whole tongue apparatus up and out of the way. The second scenario, and this is particularly useful if we're considering any sort of cervical injury, is the jaw thrust. So we put our fingers at the angles of the mandible and we push up. And that moves the tongue forward and that whole apparatus forward and allows us to breathe. So we need to open the airway to start with, and the first thing we do is we deliver 2 quick breaths if they're not breathing. Now, you can do that by various techniques. You can use mouth to mouth, a mouth to a mask, but in most cases we're going to use a bag valve mask apparatus, which will give us close to 100% oxygen saturation or oxygen content if we have the reservoir bag inflated. And so we're delivering 2 quick breaths to this patient, and that's very, very important. And in terms just generally of ventilation, in a cardiac arrest scenario, a lot of the literature has shown that any greater than 10 breaths per minute is associated with a very, very poor outcome. So we don't want to hyperventilate our patients, because what happens is that as you hyperventilate them, you increase the intrathoracic pressure, decrease the cardiac return, and so you decrease coronary perfusion and cerebral perfusion pressure. So 10 breaths per minute is about fine. And the way we will integrate the breaths is we will integrate them with CPR, or cardiopulmonary resuscitation, that is a chest compression. And certainly airway takes precedence in most cases over everything. Perhaps the only time that airway may not take precedence is if you are a lone person doing this resuscitation scenario, at which point CPR or chest compressions are probably the most important.